Thanks for staying with us on the news. Now, Governor Francis Nwifuru of Ebonyi State has announced the formation of a committee aimed at combating medical quackery in the state. Speaking after the installation of the 11th president of the Medical Women Association of Nigeria, the governor highlighted the government's commitment to eradicate quackery. He also emphasized the detrimental effect of unqualified practitioners in the medical sector, which could cause untimely deaths. Represented by Health Commissioner Moses Ekuma, the governor also affirmed readiness to partner with the MWAN in fighting female genital mutilation and gender-based violence. The state's anti-quackery committee, which is already operational, aims to expel unqualified medical practitioners. Now, to discuss this further, I'm joined by Dr. Lilian Nwaobasi, MWAN President, Ebonyi State. Thank you so much, Dr. Lilian, for joining us.
Thank you for having me.
It's a pleasure. Now, Dr. Lilian, could you elaborate more on the specific role that MWAN intends to play in supporting the government's efforts against quackery in the medical field?
Okay. MWAN, Ebonyi State Chapter, refers to all the female doctors that are resident and practicing in Ebonyi State of Nigeria. So we are a non-governmental apolitical association who have been in partnership with the state government as elaborated to help improve the healthcare delivery system in Ebonyi State. So as an NGO, Medical Women Association of Nigeria, the Ebonyi State Chapter, we have been doing a lot of awareness, because people who are not fully informed would definitely make the wrong decisions, and that would affect their health. So for the past 4 weeks since we took over and until the nearest future, we have been on the airways. We go to the radio houses every week. We collaborate with the Legacy FM, the EBBC of the state. We are telling people the right and the wrong places to choose to access healthcare. So we teach them when to notice that their health is going the wrong way, and where to seek help, and more importantly, where not to seek help, because it is when they are not well informed that they go ahead to go and seek health care in the hands of the quacks. We also, at our various entry points in the university, in the hospitals, we work at the entry points, the children, the ORG segment, the adult male segment. We are there to identify patients who have gone through the hands of these quacks and come in more sick than when they started to seek help. So we identify patients who have been through the hands of these quacks. And when we identify them, we teach them more where not to seek help. And after we teach, we report them. We report the places these patients have sought help to the anti-quackery unit of Ebonyi State government, which is already in place. So with the collaborations we'll have, we'll see these patients, we'll create awareness not to do it, and then we'll report to the appropriate authorities so that these quacks can be closed down in Ebonyi State. Thank you.
All right. Also, what initiatives or programs does MWAN plan to implement in that regard?
Okay, most of our policies are geared towards creating awareness. We want to teach people. Many people patronize these quacks because they do not know better. They all act within the information that is available to them. So we teach them, we create awareness for them, and then we also encourage government to ensure that when these quacks are caught or in these various branches of practice, that they are prosecuted so that they do not go ahead. Some of these places we also call quacks are not duly registered. So we've been in talks with the anti-quackery unit of Ebonyi State government, and during their visits to these places, they encourage them, one, to seek training if training would solve their problems, and two, to duly register their associations or hospitals or clinics if they have the qualified personnel, but because of non-registration, they are quacks. So we teach them where to seek help and where not to seek help. And then also these quack centers, as we told them, we teach them to know their limits if they have the ability to provide healthcare at all, and to know their limits so they do not go beyond what they are taught or qualified to do. Thank you.
All right, Dr. Lilian, thank you so much for joining us. Dr. Lilian Nwaobasi, MWAN President, Ebonyi State Chapter. Thank you for joining us on the news.